Welcome back, Raw Thoughts listeners, to another episode with me, Mackenzie Tiggs, where I bring on just individuals of every walk of life and we hear where they've been, where they are, and where they're going. Today, I have the pleasure of bringing on Lyndsy with Foundation Functional Medicine here in the Boise area. And it's kind of strange that we actually had crossed paths before while I was a paramedic. She was in the emergency department. And so now life has kind of brought us back together in bringing business and different forms of medicine. So Lyndsy, thank you for coming on.
Thank you for having me.
Yes.
I'm super excited.
Yeah. So tell us a little bit about what your journey has been to where you are now.
Yeah, I'm Lyndsy Kinghorn. I'm a nurse practitioner. Most of my career I was an ER nurse and then as a nurse practitioner in the ER for about 5 years. And 2 years ago transitioned kind of slowly, but into the functional medicine space and now own Foundation Functional Medicine. I do some aesthetics too, so it's actually Foundation Functional Medicine and aesthetics. And now I'm doing that full time. I still have my ER roots and work in the ER about 4 to 5 shifts a month. But yeah.
And what got you, so you go from nursing, you go from nurse practitioner, you're kind of building along all of these things. What initially got you to being a nurse?
Honestly, I never wanted to be a nurse. My grandma was a nurse. My mom was a nurse. It was a great career. I saw that, but I was like, I'm going to be a doctor. I just knew I was going to be a doctor for some reason. And when it came to that time, I had studied abroad and I just couldn't, commit to medical school. And I was like, well, you got to do something. So I went to nursing school knowing like I'll either go on to medical school or I have options. And one of my nursing school professors really was kind of really pushed me to be a nurse practitioner. She said, you would be such a great nurse practitioner. And so kind of with her guidance and just deciding like I didn't want to spend my whole 20s in medical school, I went to NP school and it was a great move. My whole life, I just knew I wanted to do ER because that's all I knew. And so I worked in the ER in Meridian, actually in St. Luke's Meridian for 5 or 6 years while going to grad school and then graduated with my dream of working in the emergency department.
That's awesome.
Mm-hmm.
And what was that transition of like, you were the nurse kind of like with the guidance of the doctors and the nurse practitioners, and now you are that role.
Yeah, it was actually kind of uncomfortable a little bit because I actually worked in the same emergency department from like going from a nurse to an NP. So writing orders and having, nurses who work beside like carry out those orders was a little uncomfortable, but honestly very welcoming. And I trained under all those physicians. It was just a great culture.
That's awesome.
Mm-hmm.
And tell us a little bit about the atmosphere of an emergency department.
Yeah, it's crazy. It's hard to describe. I'm sure you can understand this. I actually feared the question of you asking me, like, what's the craziest thing you've seen? I'm sure you get this all the time, too. Because you just can't describe, like, what we feel is crazy is so different than the layperson. It's such a team atmosphere, though, which is my favorite. The collaboration between the providers and the nurses and the first responders and everybody. It's just this cool environment. And of course, there's the patients who we care for, all walks of life, but truly just like a team environment.
Yeah. And one reason why I actually never ask that question is because I hate getting that question asked to me, because typically like the craziest or the scariest or like the gnarliest calls or situations that we've been in usually are like the most traumatic for us as well and stick with us, and also really traumatic for those people.
I feel the same way.
Yeah. And it's like, actually, I'm not going to tell you what the worst call I've ever been on, because I do not want to portray that on you, because like you said, it is your worst call.
Yeah, and I don't think people quite understand. Like, I think they have an idea of what we see and what we witness and do on a daily basis, but I don't think they really comprehend that. So I agree with you. Like, you will scar them as well by sharing those stories.
Yeah,
so,
absolutely. So the transition, you're in the ED, you're in a very like reactive, right, situation where somebody comes in, you have to treat what they're coming in for or diagnose or kind of work that up. How are you now in that functional? That's a completely different step than kind of emergency.
Looking back, it's what I was always supposed to do. I was born an athlete. I shouldn't say I was born an athlete, but I was an athlete growing up. I had a mom and dad who were very health conscious. We ate really healthy. We were active, like just lived kind of that holistic, functional lifestyle. But emergency medicine was what I knew and loved. And I truly thought I was going to retire there. Like, it was fun. It was rewarding. But honestly, kind of through my own health journey, I am a type A person. I was working nights as a nurse. I was going to grad school. I was a CrossFit competitor. I wasn't sleeping. I wasn't eating great enough. And so I was fatigued and run down and just not my normal self. And nobody could really tell me what was going on. Like, everything looks great. Your labs are fine. And I just felt like there was something else going on. And so I actually started seeing a functional medicine provider, and I was like, this is amazing. Like, why has nobody ever said, like, you're doing too much, or, you know, just talk to me about my lifestyle, my eating habits, my relationships, my sleep. Like, no provider had ever talked about that in depth. And so that kind of spiraled into like, wow, I really want to learn more about root cause medicine and how we can help people prevent, chronic illness, or how we can even reverse chronic illness. And so I did that. As being an ER provider, I started a fellowship with the American Academy in Anti-Aging Medicine, A4M, and just kind of like dove deep into the literature and that fellowship. And so I knew that I wanted to transition at that point. Like, I want to help people with their chronic illness, and I want to help people prevent that when people have been told that there's nothing wrong, there's nothing else we can do. So kind of sheepishly, I would say, I was scared to take that leap. I had a great job. I worked with great people. I made a good income. So kind of one foot in the ER, one foot out. I opened Foundation 2 years ago now. And I was just seeing patients a couple times a month, and it's obviously flourished. And now I'm doing that full time. And it's I'm in the ER about 4 shifts a month just to keep my skills and see my people. But
Yeah. And I feel like it's almost like that's still a safety net for you, right? Where it's like, it's a safety net because those are your people. But at the same time, it's also like a business where you get to now tell your other providers and your nurses, like, hey, like, let me actually help you outside of this too. Have you seen some of that happening? Or
yes, absolutely. I feel initially leaving was really hard for me. It's like almost your identity. I don't know if you felt that working as a first responder, but it was like, this is who I am. This is all I've ever known. And it was really hard. And I was also kind of concerned about backlash. I mean, functional medicine is not always well received by conventional medicine. And so that was a fear of mine. But now I love it. And honestly, talking to, yes, my fellow providers or nurses or patients even, about like, hey, let's change some lifestyle factors and see if we can keep you out of the ER. Keep returning back for the same complaint.
yeah. And I know that this is, something that I saw in being a first responder. We saw our frequent flyers, and a lot of that could have just been some conversation. And it has to do with, one, they have to take that initiative themselves, but it's also the information we're giving them. And describe kind of the workflow of ED versus functional medicine.
Yeah, it's just totally different. And I don't knock any, Western medicine provider, ER, family practice specialist. With the insurance model, they just don't have the time. We're spending 10, 15 minutes with patients. That's not time enough to like review most people's med list, honestly, much less to get to know them and how they're sleeping and how they're eating and what supplements they're taking or whatever. And so, in the functional medicine, I'm a cash-based practice, but I spend an hour with every new patient and 45 minutes almost always in follow-up. I get to know my patient. We talk in depth about lifestyle. We always fix foundational things first. So how are you sleeping? What are your relationships like? What are you eating? Are you moving your body? Are you moving your body too much or too little? And then build from there. It's just the relationship side is so much more important in that aspect.
Yeah. And it's interesting for you to say that, because I feel like the ED side is like run, right, and react, where you are now in this like, hey, let's actually kind of slow down so we can learn more and then be able to, help prevent those things. With foundational medicine, you have a lot of that foundation, right? Like you have said, the sleep and your eating and your exercise. What are some of the common things that you're seeing people come to you for?
When I started, I wanted to be like the one-stop shop. So I wanted people to come in for any reason. I would say I'm more specialized now. So I do mostly gut health and healing, hormone balancing, optimization, weight loss, and then bioidentical hormone replacement. That can be thyroid as well as sex hormones. I see a lot of people with gut issues. I see a lot of IBS. I see IBD, autoimmunity for sure, thyroid issues, whether that's subclinical hypothyroidism, autoimmune disease. But honestly, I just see a lot of people who feel like they've been failed by the conventional medicine model. They're not being heard. They feel that they're crazy, honestly, that they just, their symptoms aren't real. But I see people from all walks of life. Occasionally I'll get a patient in that's like, I just honestly, I feel pretty good, but I want to stay feeling this good, or I just want to move the needle a little more. Most of the time it's people who have had ailments for a long time they just can't fix.
Yeah. And what are the things that you do trying to find what's the root cause of this? Or maybe it's a combination of these things.
Yeah, we do an in-depth history. So my intake, people always comment, it is a lot. But for a reason, a timeline essentially, we talk about people's lives from birth to now, big traumatic life events, if they've had any significant illness, those kinds of things. I like to just start with a conversation first, change some basic lifestyle modifications, and then we always have options for testing, whether that's conventional like blood work or specialty testing as stool and hormone testing. We have options.
Gotcha. And how are you seeing these people like truly change their lives?
It's amazing. I'm still blown away most days by the simple things. Sometimes I'll get a patient in who's been to multiple specialists, like just for gut health, let's just say. They have all these weird symptoms after they eat. They're not digesting. They don't feel good. They think they're having panic or anxiety because of these symptoms. And I literally just sit down with them and change the way they eat. Like I make them sit to eat. I make them slow. I make them chew their food. Sometimes digestive support, and their symptoms are gone. Like sometimes it's just the simple, basic things. Other patients are harder. We dig deeper. We do specialty testing. We look at labs a little different than conventional medicine, a little bit more in optimal range. So sometimes we just find things a little bit differently than what you would conventionally.
And how do you look at them differently, or how do you optimize them differently?
Yeah, our ranges are just a little bit more narrow. So conventional labs essentially is the ranges are based on the general population. And as we know, the general population isn't super healthy, unfortunately. And so we look for optimal ranges. So you might be having thyroid issues or feeling like your thyroid's off, constipation, dry skin, losing hair, gaining weight, but your TSH is quote unquote normal based on labs. Well, we look for optimal ranges. So we just have a narrower range, and we just look a little deeper too of other things like micronutrients, what's your diet like? Are you, supplementing with the appropriate things? So we just look a little deeper. We look for root cause.
Yeah. And it's interesting having been on the side of getting my hormones checked.
Yeah.
And I'm like, whoa, like there is so much more actually happening, even if you have control over your life, that like your body can get out of balance.
Yes.
And talk to us a little bit about like, I think there's a lot of generalization within the population of people overweight and these problems. And I think just a lot of societal problems. Like, what is something with our hormones or our weight that we could be doing, or you advise people to be doing to help them?
Stress less, so slow down. I think the biggest thing we deal with, especially in America, is this gotta go lifestyle. Our cortisols are all super high. Cortisol breaks down. We call it catabolic. So it breaks down. So it's going to break down our hormones. It's going to break down our gut lining, brain. So we're going to end up with a lot of inflammation. And then eat less frequently is what I would tell people. I feel people are eating from the minute they wake up to the minute they go to bed. So giving your body time to rest and digest with autophagy, and then sleep.
Yeah.
Sleep for sure.
Yeah. And it's wild because that's something that people are like, I'll sleep when I'm dead, right?
That was my mentality for a long time.
Yeah. Well, and especially too with the infrequency of your schedule, What do you have to say about people that do have a very, like, I'm going to say lucid, like, schedule, whether that be our first responders or our nurses or, anybody else that even have kids, right? They're waking up a ton. Like, how can we actually help support them?
That's really hard. Shift work is very difficult. I see that. I mean, even personally, the amount of people that I've worked with who do shift work who have ended up with cancer or other illnesses due to lack of sleep and our circadian rhythm. Those are hard. Sometimes the best case scenario is we don't do those shifts, right? We go to a more conventional shift, but that's not feasible for a lot of people. Same thing with kids. You can't just like give your kid away during that time. So it's just doing your best to optimize what you can do. So that's playing with light, avoiding blue light before bed. Sometimes supplementation can be helpful, but I like to work on lifestyle before I push a bunch of supplements.
Yeah. And lifestyle, what do you include within lifestyle? That's a big word for a
Yeah.
lot of things.
Yeah, just for sleep in general, this is difficult if you're working like a weird shift work, but for just like the general population, morning sunlight always. So 10 to 15 minutes in your eyes outside, not through a window, not with sunglasses on in the morning. Our body doesn't know day and night, so it goes off of light. So if you can get some sun in your eyes, it's actually going to set you up for the day, but also a good night of sleep. And then avoiding any blue light, screens, TVs, a lot of overhead light once the sun has gone down, and wearing those super sexy, blue light blocking lenses until you go to bed. And then, having a bedtime routine can be super beneficial too. Just our body likes routine. So whether that's taking hot bath, drinking tea, we can even play around with a lot of things, eating close to bed or further away from bed. Are you having nighttime awakening? So lifestyle just encompasses what we do daily. So how we eat, how we move our bodies, what our relationships are like, and how we're restoring or resting.
Yeah. And about relationships, that's also a big topic. And I think something that people not only have with relationships with other people, but relationships with themselves.
Yes. That's something I talk with a lot about people, or a lot with people. I always am so excited when somebody comes to me and they have a mental health counselor or a therapist or a coach that they see. I applaud that. I think it's still kind of stigmatized, unfortunately, and it shouldn't be. But the stressors or relationships can be a big stressor. They can be a huge support. They can be a big stress. And sometimes the thing we need to remove from our life is that relationship to avoid having continual health problems of high cortisol and hormonal imbalances and gut issues. And that can be a hard pill for people to swallow.
Yeah, it is. Mm-hmm. And then it comes into not only removing them, but dealing with having removed them and those emotions and those feelings and, making sure that we're still going to bed.
Yes, the grieving, even if it's a poor relationship or relationship that wasn't serving you, it's still a grieving process when you lose that.
Yeah. And I asked this as a strong female that you are, right? How have you dealt with relationships through, building yourself? Like, this is a very woman dominant, you're in a kind of a male dominant environment in the ER and, just being that like medical professional. How have you encompassed relationships with this very empowering woman aspect?
Yeah, I think you just first and foremost have to have a good relationship with yourself. I've had a lot of times where I've had imposter syndrome. I still do sometimes. Like, am I good enough for this? Am I doing the right things? But I think having a good relationship with yourself first and foremost, because then you set boundaries, right? You know your worth. You know what you want and what you don't want in your life. It can be hard. I think you can be cordial to people, but you let some people closer than others. And I realized, especially in the ER, I don't feel that way right now, but like even relationships with consults or other providers, when they don't treat you very well, it's not about you. You just have to kind of have that removal, or it'll eat you alive.
Yeah. Mm-hmm. Well, and I think too, like you said, like those relationships with your patients, right? Like, you are the provider, you are the one giving them the information. And maybe it's not something that they want to hear, but it's something that they need to hear.
Yeah, I actually struggle a little bit more with I want to be friends with everybody and having that boundary. I get such a cool relationship with my patients, and I love that. And I think that breeds such a cool environment for them to heal in, but also like I'm still a provider. I can't be everybody's buddy, or their best friend, or hang out outside of the clinic, but I want to.
Yeah. Yeah. Well, and I definitely I can feel that with like so many different walks of life. And it's hard. It is a boundary of like, hey, I actually don't have the energy for this and I cannot, provide. And that also comes back to like, hey, I can't give you this energy because like I need to sleep at night and these are the things of my own lifestyle. So I definitely feel you of like, I just want to be friends with everybody.
Yeah.
It's hard.
It is hard. It is hard. Yeah.
Where do you see your business transforming? You're very new into this. There's a lot that you have, kind of encompass with this. Not only the medicine part, but also owning your own business. Tell us a little bit about like owning your own business.
That's been a journey. The medicine side I love. I continually educate myself. I love learning. I don't know that I love learning about owning a business. And that's been, I have a lot of amazing friends who own businesses and they've been mentors in that aspect, but it's hard. It's not for the faint of heart to own a business. But for the practice, I would love to have like a full-on wellness center. I have met so many cool other, like mostly female. I've met a lot of cool men, but the females always kind of resonate with me. Either in the health and wellness or medical space that just want to give good care to people. And I would love this kind of wellness center where we're all under the same roof and you come in and you get, medical care by me and you can see a nutritionist and you follow up and you can get your IV therapy and you can do your aesthetics and just like this full on wellness center for women run by women. And that's the vision I have for Foundation, hopefully soon.
That's awesome.
Yeah.
Tell us a little bit about the business side behind this. Like, what have you endured?
Oh man. So when I first started, I kind of went in like 1 foot, 1 out, and I just rented a space from a local naturopath and his wife. Super great people. I was like, this is a great, like, low overhead. We'll see if it even happens. And so I didn't know, obviously I still had my LLC and the other things that come along with that malpractice and all that stuff, but really the business side was more on them. And then I transitioned out on my own. And that was a big undertaking. Thankfully, I'm like a systems person. So I have a lot of systems that work well for me. And I just want the best patient experience. I have an amazing virtual assistant who's really helpful for all my patients and myself. And that will obviously continue to grow and expand as Foundation expands. But for now, it's a small clinic, one per provider, but I feel like it feels welcoming for my patients.
Yeah. And I think you are being a great example of like that slower, right? Like not that hustle and bustle where you're not like, oh, I built this huge, wellness center right off the bat. Like you're taking it one step at a time and kind of delegating as well, right? Like, hey, I can only manage so much. So I'm going to give this to my virtual assistant. And you're still practicing your best lifestyle, which is super cool to see.
I have to. I mean, I burnt myself out really in emergency medicine, going hard for so many years, and I don't want that. Like, I want to preach practice what I preach to my patients. I think about that all the time when you get this imposter syndrome, like, oh, I should be busier, oh, I should be seeing X amount of patients, or they're doing this. And I think to myself, if I got as busy overnight as I wanted to be, like long term, could I handle it? And I know I couldn't. Yeah. And that slow, steady growth is amazing because most of it's word of mouth. That's the best thank you, right? A patient refers a patient or a friend because they liked the care they got. And I want to continue to give that good care. And I think that slow, steady process will allow that.
Yeah. Do you see a lot of other holistic businesses like this in the Treasure Valley?
More than I thought there was. I get patients from other people all the time, and they're like, oh, I saw so-and-so. I'm like, I don't know who they are. When you get into this space, you realize how many people are actually doing this, which is amazing. But I think there's such a need.
Yeah. Well, and I think I refer back to real estate, right? Like everybody knows a realtor. Like everybody has a friend. Everybody has somebody that they should, or that they go to. But yet people are still in the industry because they know different people, and I think that's the way that like holistic medicine should start leading to is like, hey, it's okay if you have your own holistic, medical provider and I've got mine. And like, that just means that you have somebody, and that's important.
Also, I totally agree. And honestly, I think a lot of us like have niches in a few things. Like I focus on gut and hormones, and there's people who focus on mold and Lyme. And, like it's so cool that we can collaborate and work with each other to be like a healthcare team for people. And it's not, it doesn't have to be as competitive.
Yeah. I just as you're talking, I see you have the Aura ring.
Yes.
Tell us a little bit about like you, right? Like you are being that best practitioner. Like what are you looking at for yourself?
Yeah, I've worn the Aura ring now for about, 4 years. Have they been around 4 or 5 years? Like one of the first people to get the Aura. I've always wore activity trackers, but really I cared more about my sleep. My sleep was something I worked on immensely. I worked nights for a long time, and it tore me apart. I could not. I'm a like go to bed at 9, wake up at 5 kind of girl, and so the opposite really killed me. And so it's great data. It's probably the best sleep tracker on the market. I love it. It's a sleek little ring. You wouldn't even notice. But it's great for tracking your sleep, your deep sleep, your REM sleep, your HRV. Honestly, it's the first thing to tell me I'm getting sick. I got sick last week, and it was like, your body temperature's up, your heart rate's up. And I was like, oh, okay. And the next day, sure enough, fever. It's crazy. It's very insightful. But I think it's just data. I'll tell patients this all the time. Yes, wear it, but don't be married to it, right? I don't want you. Some days I'll wake up and I don't look at it for the first like 90 minutes of the day, because it could set the tone for the day. Like, oh, I was restless, I didn't sleep good, now I'm going to have a bad day. It doesn't have to be that way.
Right.
But it's great data to have. I would love everybody to wear one, or some sort of a sleep tracker just to get some data. I move my body. I like all sorts of activity. We ski, we mountain bike. I was a CrossFit athlete, so I dabble in CrossFit a little bit. I just try and live the best life I can to be healthy long term. I also tell my patients, like, you got to live, so you don't have to beat yourself up if you eat a cookie or if you eat outside your fasting window, or, whatever. You stay up later because you had a party or whatever to go to. That's great. It's like 90-10, 80-20. You also have to live.
Yeah. And that is a great reminder, because so many people are so like, no, this is what I have to do. And this is, it's so strict and rigid. And it's like, life is an ebb and flow. Like when you have that extra energy, like do the things that you can do and you have that energy for. When you're restful, like it's okay, and I will tell you, it is hard. It is hard to do that, and I'm one of those people that I don't rest the best. And so like even, yesterday and today, I'm like, oh my gosh, I didn't check my emails and I didn't do anything. And I laid in bed and I read a book, and I'm like, no, but you deserve that.
Absolutely.
It's okay to do that.
I would say I don't think there's many people who come into my clinic that don't have hypercortisol, like that don't have like this always being chased by a lion, always in the sympathetic state. It's so rare that somebody's like, yeah, my life's not very stressful. It's pretty easygoing. That's rare, right? And so we never want to add stress to a stressed body. So same thing, like if we have to be so strict about, let's say you have autoimmunity, and I'm like, let's try removing gluten, because that's probably going to help you long term. And they eat a piece of gluten and it like destroys their day. Like that's not helpful either, right? Adding stress to a stressed body isn't the goal. And so it is all about a balance.
Yeah. That's super cool. And I want to give a shout out to Dr. Clayton, because he's the one that, Eliza had referred you to me, which is totally that like big thank you, right? Like when somebody can say like, hey, like I had a wonderful time with her, like, and you should do that too. So I know they listen. So here's a little shout out to them and that referral, which is super neat.
Yeah, I agree. I have had such a cool building relationship with them. I haven't met Eliza yet, but Dr. Clayton and I had a great conversation one night, and we work well together. I mean, as you know, gut health starts in the mouth. So if you don't have a healthy mouth, you're not going to have a healthy gut. So it's been so cool to connect with other practitioners who are like-minded.
Yeah. And it's cool because that is part of their mission. And it sounds like that's also another, part of your mission, where you do get to refer to other practitioners in the area of saying like, hey, here's my specialty, and I can't do that, but I have somebody for you.
I love that.
And it's cool to see that intermingle of like, hey, we are actually here all together and not against each other.
Yeah, I say that all the time. For some reason, I just feel like the functional medicine space, for the most part, is so collaborative. Like, it doesn't feel like competition. Like, I do some aesthetics too. I feel like the aesthetic world feels so competitive. Like it's uncomfortable when you go to like a conference. I don't feel that way in the integrative functional space. I feel like our mission is to change how people are receiving health care and to give people of our community good care. And yeah, if I'm not that person for you, man, I do know who can be.
Yeah, that's super cool. And I love hearing just your story of like, you were in that space of emergency, but you also saw so many people that it could have been prevented. And now you're in that space of, hey, let's actually try to prevent this. You know, there's so many people in the world, whatever your walk of life is, where they almost complain and then they don't do anything. Like you're here sitting, doing something about it.
Yeah, I love, and even, I mean, people get in this victim mentality too. And I feel that with patients. I don't feel that in my clinic, which is so cool. I feel that people who come to me are so motivated to either optimize their life or figure out what's going on with them or heal. And I love that I can bring that into the ER too. Some people it falls on deaf ears, but honestly, for the most part, if I sit down at discharge and talk to somebody who comes in with abdominal pain about their diet, they're so thankful. Nobody has ever discussed diet with them at all. Or how are you eating? Are you sitting down to eat? Are you chewing on the go? Are you drinking with, like, there's just so many things that are just simple changes that can change a patient's life that nobody's ever talked about, and they don't have time. So again, I don't knock them, but just spending more time with people.
Yeah. Well, and I think it's too, we don't know what we don't know, right? And so even just as a human, it's like, how would I know that, right? How would I know for somebody to tell me to slow down or to chew more before I swallow? Because if I don't also tell them what my problems are, they can't help me in that return.
I totally agree.
Yeah. While we wrap up, like, is there anything else that you want to talk about? You want to cover?
I don't think so. I'm so excited to have connected with you in this space and kind of share my story with people and what I can offer people of the Treasure Valley. Yeah.
And how can people reach out to you?
So website is foundationfunctionalmedicine.com. Our number's on there, or they could send us an email. It's all on there as well. And then I'm on Instagram at Foundation Functional Med. I'm pretty active on Instagram as well.
Awesome. Yeah, I've seen some of your videos and just like information, and it's so great for you to just like be putting that information out there, because then that'll attract who needs to see it and who needs to hear it and be able to reach out.
I hope so.
Yeah, absolutely. Well, Raw Thoughts listeners, thank you for another episode. You can get all of her contact information also in the show notes. So if you are looking for a functional medicine practitioner, if you would like to just reach out to her and see what she does in her story. And I just thank her so much for coming on and sharing that, transition of what it's like. And we will see you next week for another episode and another person sharing their story. So thank you and have a great day. Thank you again for listening to another episode of Raw Thoughts Podcast. I'd appreciate it if you could follow, like, subscribe, and share with anybody that you think would be interested in this. You could also head over to my website at rawthoughtspodcast.com and see any other guests that have been on the episodes. You could also go over to Instagram and follow at rawthoughts.podcast. I would really appreciate it, and always send me a message if you're interested in being a guest or any feedback.